You're listening to Beyond Wellness Radio, bringing you the cutting edge in health, nutrition, and sports performance. Stay up to date and listen anywhere, anytime on your computer, tablet, or smartphone by subscribing on iTunes. Catch your hosts, Dr. Justin Marchegiani and Barris Harvey, as they answer your burning health questions, as well as interviews from world-renowned guest experts. For more Beyond Wellness Radio, go to beyondwellnessradio.com.
Good. Today's episode is going to be all about the thyroid. Now, there's a lot of things going on in our world today where a lot of people are having thyroid problems. You know, this is the master control of your metabolism. And of course, when people want to lose weight and they're doing all that they can, but they're finding that there's deeper issues going on, just dieting isn't going to help if your thyroid's all thrown off. So today we're going to have one of the leading experts in thyroid regulation talking about this. Dr. Justin does a great job with, almost everything. Like, I go to him for almost everything, but one of the things that he's like super duper good at is fixing somebody's thyroid, and that's why he has a site. If you go to beyondwellnessradio.com, we actually have a tab that links to Fix Your Thyroid. That is something that Dr. Justin has. So let's just dive right in. Like, before we even ask, let's just go into some basic anatomy. Like, what is a thyroid?
Great question, Barris. Well, your thyroid gland, it's about the size of about a bow tie, if you will, right in the middle part of your neck. So if you feel your Adam's apple, a lot of people think that's your thyroid. It's just a centimeter or two just below your Adam's apple, and it just spreads out just like a bow tie. So it sits there just below that Adam's apple cartilage on your neck. If you're a female, obviously it's going to be less protrusive, but you can feel there. That's kind of the general proximity of your thyroid. Now, when we look at your thyroid, it's kind of the center of metabolic activity in the body. Right? Thyroid hormone controls metabolism, energy. A lot of our hormones actually get broken down, like the precursors to our hormones get broken down by thyroid hormone. So if you're hypothyroid or have inadequate amount of thyroid hormone, our ability to break down cholesterol, and this is really important, I'll say it again, our ability to break down cholesterol. Yes, cholesterol is the raw material for all of our hormones, and there's actually receptor sites on cholesterol, on the cholesterol molecule, for thyroid hormone. And we need adequate thyroid hormone levels to break down cholesterol, and it's being broken down into building blocks for our hormones. And those hormones could be testosterone, estrogen, progesterone, the whole 9 yards. So it's very important that thyroid hormones is adequate. Now, when we look at thyroid function, we kind of have to have a top-down approach. And what I mean by that is we have to look at what's the first domino in thyroid physiology that gets the ball rolling, if you will. And that's the brain. So when we look at thyroid function, we have to start with the pituitary and the hypothalamus. They produce various releasing hormones. So to keep it really simple, we have TRH that's released from the hypothalamus. That's thyroid releasing hormone. That stimulates the pituitary to release TSH, which is thyroid stimulating hormone. So to keep it really simple for any layperson listening, imagine your brain producing a hormone that screams down to your thyroid, hey, make some more thyroid hormone. That's what these brain hormones are doing. They're just yelling down to the actual gland saying, produce some hormone. And then we have the thyroid tissue then saying, okay, I'm going to produce some T4 hormone. T4 is an inactivated thyroid hormone, and that's converted peripherally in the body. And there needs to be a specific environment conducive to that adequate conversion, because most people don't convert it well. And a lot of people actually have an autoimmune condition that can make the problem worse. And that T4 gets converted into T3, which is active thyroid hormone. And that T3 can bind to receptor sites throughout the body and have an effect. And there's a lot more details that we can kind of, go into specifically as you ask me more questions about each step, because it's really important. But I just kind of want to lay out a kind of a layman's type of approach of what's happening. The first domino is the brain, the hypothalamus, and the pituitary. The second domino is T4 production from the thyroid gland, and then the next domino is T4 to T3 conversion by the gland in the periphery to T3, and there's a couple of things there that can kind of interfere. But those are the first three dominoes, if you will, that kind of set the foundation for the listeners.
Okay, perfect. So just listening to that, our thyroid is going to be making you said T4, which is an inactive hormone that sends it down to the rest of our body where there's a conversion being made. So just because we have low thyroid, I guess the active hormone doesn't necessarily mean that our thyroid is underactive. It could be the conversion process is not efficient.
Correct. So most medical doctors and even natural physicians are only looking at TSH as an indicator of thyroid function. So the whole idea, if TSH is high or elevated, imagine you screaming louder and louder and louder to get someone to do something. It's kind of a sign that the gland is just not quite listening, and it's not producing enough hormones. So then the body would then produce T4. So most people, when they get their thyroid tested, it's only TSH. If you're lucky, you get T4. So like you kind of already alluded to, that environment has to be there for T4 to get converted to T3. That's really important, and we'll touch upon what adequate environment needs to have there for that conversion to take place. But like you were saying, most people are only getting TSH at the most T4 assessed, and that's a problem because it's going to take years for TSH to start to elevate, and there's a good amount of research out there that TSH is inadequate for assessing thyroid hormone.
So I kind of have like two questions off of that. One is, where does the majority of our T4 to T3 conversion happen, or where are the different locations, like maybe some in our gut, some in our liver, elsewhere? And what are probably some of the tests that we should be asking our doctor to assess our thyroid hormones?
So yeah, when we have thyroid conversion, T4 to T3 happens in the periphery. About 60% is going to happen in the liver. So we need adequate liver and detoxification capacity. That's really important. So making sure we're not putting a ton of toxins in our body is going to make it, or give us the ability for us to convert T4 to T3. By having healthy bacteria levels, T3 acetic acid and T3 sulfate, we have this enzyme called sulfatase in the gut. And when we have healthy bacteria, sulfatase can actually convert T4 to T3 adequately. So it's super important that we have good bacteria levels in the gut. And typically, most people have a dysbiosis, which is an unfavorable amount of bad bacteria in relation to good bacteria. And that's what we call a dysbiosis. And that's going to decrease this enzyme activity that's going to help with this T4 to T3 conversion. And then last but not least is stress. Our body will convert T4 into reverse T3. And reverse T3 is kind of like, it's like a dummy bullet. It kind of comes in there and blocks the receptor site for thyroid hormone. All right? It's like shooting blanks, right? If you're shooting a gun, you want to shoot a bullet. But when you put reverse T3 in the thyroid receptor, it's like loading a blank in a gun. A blank bullet in a gun. So you don't have the metabolic activity that you have when reverse T3 is in the T3 receptor. There's even research out there showing that it's like you have medications that are given to patients to reduce thyroid function. So if you're a Graves patient or a hyperthyroid patient, the reverse T3 is shown to even have 100 to 1,000 times more activity than some of these medications do at decreasing thyroid function. So it's very, very powerful at decreasing thyroid function, and most endocrinologists kind of haven't given it its due diligence. They're too obsessed over TSH, and they're not really looking at reverse T3. It's just because the paradigm they operate in, there's not much they can do, because it's a symptom drug paradigm, where we're kind of in a systems-based approach. We're looking at hormonal systems, thyroid systems, female hormones, digestive systems, detoxification systems, and there are things that we can do to upregulate these systems with diet, lifestyle, sleep, exercise, supplementation, natural medicine, hormonal support, etc. And removing infections too.
Yeah, definitely. So is there always just going to be a certain amount of inactive, like just what's not converted to T3 just automatically gets converted to reverse thyroid, T3, or is there a certain blocking factors that can cause like this overactive of creating all these blanks, all these reverse T3?
So if we have extra adrenal stressors, so let's think of it as this. When I look at the thyroid, I never look at the thyroid in isolation. I think that's a reductionistic approach, and I think most medical doctors have that approach. And we need to move away from that and have a more vitalistic, holistic approach. And what I mean is we have to look at the adrenals and the thyroid together. Mm-hmm. And even looking at the female hormones together is really important because we get a good approach of what's happening in the body. And what I mean by that is if the adrenals are extra stressed, we need cortisol, which is being produced by the adrenals for thyroid conversion. If we don't have enough cortisol being produced from the adrenals, we're going to have inadequate thyroid hormone conversion. I mean, we're not going to have enough T4 to T3, and we may even start converting more of our T3 even into reverse T3. So we'll start to see the ratio shift regarding reverse T3 to T3. That's a really important ratio that I think is becoming more and more prevalent today, especially in the literature, showing that reverse T3 to T3 ratio needs to be at a healthy, ideal range.
Okay, cool. That's good to know. What are some of the other thyroid hormones that we should be looking at, like kind of like T3 uptake, maybe TPO and TG antibodies? Like, what are some of the other things that we should be asking our doctors that we should get tested, or maybe get tested from somewhere else, and to really take a look at to see that what can be impacting our overall metabolism?
Great question. I just want to touch upon one thing because it has to do with the question you already asked. Mm-hmm. But again, we should have this 10 to 14 ratio of total T3 to reverse T3 ratio, or reverse T3 to total T3. We'll put a link in the show notes where patients can plug in their laboratory data into a calculator and they can convert the ratio. But literature is pretty clear that this reverse T3 to total T3 ratio is really important for looking at thyroid function and can be a much better indicator of how your thyroid is doing.
Oh yeah, you set me up for a good question. I slipped that one. I think I was thinking it, like maybe I should ask that exact ratio, and then I think I just got ahead of myself and went for the other test. But yeah, that's definitely good to know what are the ratios, and to making sure that we're not just getting a number that might look good by itself. We might have good T3 numbers, but if the reverse T3 is super high, then it's kind of insignificant. So to make sure that the ratio, and kind of like you mentioned, taking more of a holistic and functional approach and looking at the body in a system and looking at the numbers compared to other numbers in your body. So yeah, so that's really good to know, and we're going to have that for our listeners on beyondwellnessradio.com. And then you just look for this podcast, the Thyroid, and we'll have that in our show notes. So yeah, back on to what are some of the other things that we should get tested?
So getting a comprehensive panel is going to be really important. We want to look at TSH as well. That's a conventional marker. Mm-hmm. Now, I'm not a big fan of this marker, but it should always be run, because if it is elevated, you definitely want to get that addressed and fixed. At the very least, you want to get on some type of thyroid hormone. I'm more partial to a full spectrum bioidentical thyroid hormone, but you want to get that treated. Having higher amounts of TSH is definitely a sign that there is a thyroid problem. My biggest qualm with the issue is that it's just a late stage indicator. It's typically you're going to be diagnosed with a thyroid issue 8 to 10 years after that TSH has been elevated. So it's not a really good indicator in functional medicine, because we want to look at markers that are sensitive enough to tell us there's a problem right away or as soon as possible. We don't want to wait 8 to 10 years. And I'm just really kind of fed up with the conventional medical community, because what they do is they just say, well, we're not going to use sensitive testing, we're going to use archaic testing, and then we're going to tell you that nothing's wrong. And what we're essentially saying is get sicker. Our testing, our paradigm isn't sensitive enough to pick you up. So they make the patient feel like it's all in their head, and they keep on doing the same thing. And then 5, 8, 10 years later, it's like, oh wait, there's a problem. But wait, they told me there wasn't a problem. And it's just what they're saying is, and it's just the paradigm is a little bit limiting. That's what it comes down to. It's not an intentional thing. It's just a limiting paradigm that it's a late stage indicator. So we need a full spectrum of test. TSH should be part of that.
So TSH being elevated is kind of like a late response to there being some underlying problems, and it's your body's way of I guess it expected for it to be fixed already, but you're probably still having these same problems. And later on, what the manifestation of symptoms, your TSH will start to elevate and try to just put more of the thyroid stimulating hormone in order to see if anything else catches on. Like maybe your T4 and your T3, the active form is starting to get really low, but rather than fixing that problem, like you're not really doing anything, and then your body's finally like, hey, well, let's just, I guess, take more chances and just start to produce more TSH, and maybe something will catch. So that's kind of what's happening.
Exactly. And sometimes patients have their primary hypopituitary, meaning the stress in their body has dysregulated the pituitary gland and the brain from communicating to the thyroid. So you may never ever show up because that gland may be just so broken, that thermostat, if you will, because think of a thermostat. If the thermostat's set at 70 degrees in the house, but the temperature goes up to 75 degrees, the thermostat would typically kick on the central air to knock the temperature down, or vice versa. If the temperature dropped, the thermostat would kick on the heat to bring it back up. So think of your brain as like that thermostat. And when stress happens, well, if the temperature drops and then the air conditioning kicks on, well, that's kind of the equivalent of, stress happening, and then the temperature's, going down, the heat should kick on, but it's not, so the thyroid hormone just stays low because the air is kicking on, if we're using the central air analogy. So the body needs to be using the brain as a good feedback indicator of communicating with the thyroid what's happening. And when stress accumulates, right, those physical, chemical, and emotional stressors accumulate, that's going to dysregulate the brain from knowing what's going on, and it's the equivalent of a broken thermostat. So that's why we want to look at T4, free and total fractions of T4, because that's just that's kind of what the thyroid is producing in response to the pituitary. And then we also want to look at T3, total and free. And when I say total and free, it's important. About 98% of thyroid hormone is going to be serum bound. 98% serum bound, and only about 2% is going to be free fraction. So when I say serum, imagine your thyroid hormone, and it's being bound to a protein molecule. Now, when it's bound to a protein molecule, it's not able to bind into a receptor site. So think of a receptor site as a lock hole. So you have a lock that, let's just use the analogy of the lock to open up your car, or to stick the key in your car to turn your engine on. That's like the receptor site. The key to your car is the actual hormone. So imagine someone having some type of device over the actual lock where you can't stick the key in. Well, that's kind of like protein-bound or serum-bound thyroid hormone. You're not able to bind it into the receptor site. So only 2% of thyroid hormone can actually bind into that receptor site. Only 2% of the keys, if you will, can actually go into the engine or into the ignition to start the car. Does that make sense so far?
Yeah. So basically, you're saying it's on the hormone, so it's more so like if the key was, our active free T3, and there are other ones that are bound, it's almost like your key kind of being stuck into this lock. And so when you go to take it to the receptor site, being the car engine, you can't pull your key out to actually turn on your car.
Exactly. So when we look at total thyroid hormone, it gives us a good idea of what the strength of the gland is. How much is the gland actually pumping out? And when we look at the free fraction of the thyroid hormone, it gives us the ability of what's actually there that can have an effect on the body. Does that make sense?
Yeah. And is there going to be some kind of dysfunction if there is a really low number or an overly high number of free T3 or T4?
Absolutely. So again, when we look at the thyroid hormone conversion, we want to look at it from a top-bottom approach. So I always look at it as TSH, right? That's the first domino to go. If TSH is okay, that we at least make sure the upstream signaling is doing good, then we go to T4. We want to look at free and total. Typically, the markers or the ranges that I like are usually between 6 and 12 units for a total T4. I'm a big fan of going up to 8 to 10 in that area. That's an adequate amount of hormone being pumped out by the thyroid. And then from that free fraction, the functional range that I use is 1 to 1.5 on your typical LabCorp thyroid test for the free fraction. And so I'm using functional ranges because a functional range is kind of telling you where you should be for optimal health, where a disease range is looking for pathology for disease. But the problem is you have to go out of the functional range to get into a place of disease.
Right, exactly.
So if we use the functional range, we're never going to miss someone, right? But if we use the disease range, we're going to miss lots of people because someone with the disease is just someone that's that far outside of the functional range. So as long as we're using that functional range, we're going to pick them up either way. But if we use the disease range, we're going to miss people that are walking off that cliff. You know, if that cliff is 20 feet long and you're not picked up as a disease until you're off that cliff, well, what if you're right on the edge of that cliff? Or what if you're walking in a direction that's pretty fast towards that cliff? We want to know that, and we can assess that using these functional markers, using a functional range, versus just judging if you're in a bad place by being off the cliff. If you're off the cliff, it's already too late.
Is that like kind of like the daily value of like vitamins, how you need at least this much of vitamin D to not get rickets, or like this much vitamin C to not to get scurvy or something like that?
Exactly. I mean, we have the RDA, which, I like Dr. Bernstein's summary of the RDA. It's basically rats, drugs, and assumptions.
Yeah.
Versus, what we actually need nutrient-wise for optimal health, right? We have nutrient requirements to starve off diseases like beriberi, like the vitamin C deficiency diseases, scurvy, etc. But we also know there's different levels for optimal health too. And if you're someone that's working super hard, burning the candle at both ends, an executive, someone that works super hard in their career, whether they're a mom working a full-time job and helping kids, you're going to need levels much higher to deal with that stress and to buffer the stress.
Okay. It's basically the same way with the RDA and kind of some of the lab tests. It's basically saying this is what you need to not be sick. If you go under there, then you're probably sick, versus here's how you need to feel to be great. I think there's a book called Why Normal Blood Scores Aren't Good Enough. We can link that in the show notes as well. And it kind of explains like kind of this whole process. And it's funny because as the population continues to get more sick, more overweight, more just health-wise kind of deteriorate, it kind of changes the mean and the medium of what is considered to be average. Therefore, what is considered to be healthy continues to decline on these test scores. So that's why it's probably, like you said, important to take what is the functional range of these blood tests versus just what is the average that says, hey, you're okay, you're good enough to not take a drug.
Exactly. So when we have adequate thyroid testing, we can kind of see what's going on. And then when we use these functional ranges, which you kind of just alluded to, we're getting a more complete picture. So kind of where I left off, we talked about TSH, total T4, free T4, but also total T3 and free T3 are important because there's a lot that goes into T4 to T3 conversion. A lot that goes into it. And I'm going to read this quick excerpt of a study back in 2003, because I just heard this so many times from my patients, and I really want to just put the evidence out there, is most, even endocrinologists that I know, even the most brightest and trained endocrinologists, they're typically looking at thyroid function based off of TSH. And it's great if your TSH is elevated, it's definitely a marker of thyroid conditions. I'm not ever going to say that's not the case. The problem is, what if you do if your TSH isn't elevated yet? And again, this study alludes to, I'm going to read it verbatim, the serum concentration of TSH is unsatisfactory as the thyroid gland and the pituitary are more sensitive to changes in the concentration of T4 in the circulating tissues. It's clear that thyroid hormone and TSH concentrations cannot be used with any degree of confidence to classify patients as receiving satisfactory, insufficient, or excessive amounts of thyroxine replacement. So what it's really saying is TSH really can't be used as a indicator of enough thyroid hormone. That's why I'm a big fan of actually looking at T4 and T3, looking at everything. And then we can also use temperature as another indicator of how the patient's doing. I mean, there's lots of anecdotal evidence. There's lots of anecdotal evidence from Broda Barnes, who was a physician in the, I want to say, 50s through 70s. Dr. Wilson temperature syndrome, has lots of evidence on this using temperature. And it's a great way to combine empirical objective evidence using temperature, as well as laboratory evidence, and then using subjective evidence. How do you feel? Because we're not treating a lab test, we're treating a patient, but it may be important to use lab tests as a guiding measurement once we get that person there to confirm, to make sure we're not missing anything.
Definitely. Any other, before we go into some more questions, because I know we're getting probably pretty nerdy for some people, just about talking just on the thyroid test and just more of the anatomy portion of it. But any other markers that you want to make sure that if somebody's going to go out to see their doctor and they want to make sure that they're getting the markers done, and we'll leave this in the show notes for people so they don't have to write it down while they're driving or anything. But you mentioned TSH, T4, T3, and that's for both of those, total and free, reverse T3. Any other markers that you might want to mention?
Yes, definitely reverse T3, which is an important sign. I think the reverse T3 / total T3 ratio is an excellent indicator, one of the best indicators of thyroid function. Also looking at thyroid antibodies, because about 90% of thyroid issues are autoimmune in nature. And just to kind of make sure the listeners understand where I'm coming from, I have an autoimmune thyroid condition called Hashimoto's, which I have elevated TPO antibodies, and they actually do shift around. My latest test, I had elevated thyroid binding globulin antibodies, but my antibodies actually have been dropping, and some tests will actually come back negative, which is great. So I do have the genes for it, but if I do the right things supplementally, diet-wise, managing stress, my body can essentially decrease the expression of those genes, which is great. But getting back to your question, reverse T3, thyroglobulin is really important, because if the hormone's bound up by proteins, that could decrease the whole receptor site thing we talked about, the key going into the ignition, if you will.
So if you tested your T4 and T3 and you notice that your free T3 was pretty low, would then you look at that thyroid globulin to see maybe that receptor might be high?
Yeah, absolutely, and that could go up if you're on birth control pills, or if you're in estrogen dominance. And we'd also want to look at T3 uptake. We want to look at how the receptor site's uptaking T3, because if we have a person, like a female who's maybe has PCOS, polycystic ovarian syndrome, and maybe has elevated levels of testosterone, we may see higher amounts of thyroid hormone being uptaken into the gland. Or if we have someone that's estrogen dominant on birth control pills, we may see lower uptake of thyroid hormone into the gland. So looking at thyroid binding globulin and or T3 uptake is also very helpful.
You just made me think of one of our next episodes. We have to talk about PCOS on our next episode, because I have a lot of clients that come to me, and that's one of my favorite things to work with, because when I have a client and they're like, hey, I want to lose weight, there's a wedding coming up soon and I need to look good, or there's a high school reunion and I want to look good, most of the time I'm like, I might not be the right person for you, because it doesn't seem like the motivation is there. It's just so temporary. Whereas somebody that comes to you and you're like, look, I'm 30, I'm 35, and I'm overweight, or I might have these problems, but I want to have a family. And my doctor said that I can't. Like, that's sad. You know what I mean? That's someone's going to be motivated to make that change, to do whatever it takes. And like, those are some of the patients that get the best results. So we definitely, so we're definitely going to have to record a show on PCOS.
Absolutely. I love that.
All right. So cool. So we went ahead and let our listeners know that when you go to your doctors or even a functional practitioner, you want to make sure that you're getting your TSH tested. That's your thyroid stimulating hormone. Also your T4, T3, total and free. So that's going to be your inactive and active hormone, the thyroid globulin, which is going to tell you about the what is bounded to the hormone, your reverse T3, your T3 uptake, and then also your TPO and TG, the antibodies. So some of the to make sure that you're not having like an autoimmune condition, because like Dr. Justin said, a lot of the people that have thyroid issues are having an autoimmune thyroid issue. So speaking about the thyroid autoimmune, you mentioned you have Hashimoto's. What are some other ones, maybe like Graves? What are some other autoimmune conditions that you see in your practice often?
Well, typically autoimmune condition, just to make sure we're on the same wavelength, is anytime your immune system is out of balance and destroying tissue in the body, whether it's your thyroid with TPO antibodies, or if we're developing GAD antibodies or antibodies to our pancreas, that could be type 1 diabetes, or antibodies to the lining in our stomach, that could be a celiac disease type of thing. So that's kind of what an autoimmune condition is, and it's typically the healing response of the body kind of gone awry due to stressors, due to leaky gut, chemicals, toxicities, the whole 9 yards. So I see primarily a lot of thyroid conditions. I find a lot of people are latent or kind of gluten-sensitive celiac people, where they would never be diagnosed as celiac by a gastroenterologist, but they have all the symptoms of celiac disease, but they're just more at a realm of gluten sensitivity. They'd never be thought of as being celiac. So that's a common one. Crohn's and ulcerative colitis are other autoimmune conditions of the intestinal tract, where it's just extra or excess inflammation in the intestines. That's a real common one that I see in my clinic. So those are the biggest ones. Thyroid is just huge, because you get about 5% of the population with an autoimmune thyroid. I mean, you could just go outside your house and throw a rock and probably hit someone with an autoimmune thyroid condition. And there are just as many people that are undiagnosed, which is just so scary, because, I mean, typically you go to your medical doctor or your primary care physician, and whether you're autoimmune or not, the treatment doesn't change. You're going to be given Synthroid, you're going to be given Levoxyl or levothyroxine, that's it, whether you're autoimmune or not. But knowing you're autoimmune is so important. The dietary recommendations, the nutrient recommendations. I would recommend going on more of a paleo autoimmune diet, putting adequate levels of selenium in your diet, potentially avoiding iodine at first if you're an autoimmune thyroid person, because that can exacerbate inflammation for some people. That's a real controversial thing.
Yeah.
There are doctors out there that are just anti-iodine, like Dr. Karazian and such, and there are doctors that are very pro-iodine, like Dr. Bernstein, and I respect both of those doctors, but you have to look at it from both sides of the fence, and you have to look at the research too. And I think we'll have to do a thyroid part 2, because there's just too much information to go over here in just one podcast. I don't want to overwhelm our new listeners here.
We might have thyroid part 1, 2, 3, 4, and 5.
And just for anyone listening, if you want more information, you can go to fixyourthyroid.com, or you can go to justinhealth.com. I have a free thyroid video series where you can learn more about thyroid and just kind of get your all the information you could ever want. Totally get your nerd on.
Yeah, definitely. I mean, you're going for days for how the thyroid works, and it, like we mentioned earlier, it's starting to become more popular. People are starting to look at it more intuitively and started to pay attention to it more, because before, like, you didn't really hear much about it. But it's good that people are recognizing that the thyroid has a lot of control over your body, and like you mentioned before, it all starts in the brain, and it's gonna be, and we're all interconnected. So like you mentioned, you're not just gonna look at your thyroid by itself. You have to see how are your adrenals doing. You even mentioned before how bacteria helps increase our T4 to T3. So like if you have bad gut bacteria, if you're taking antibiotics all the time, like 20% of your conversion of your metabolism is going to go down because of the bacteria in your gut. So yeah, it's very, very holistic and functional mindset. Also, what's going to be provided when you go and take a look at those videos, it's not just going to be, well, here's thyroid by itself. You're going to get a nice holistic view and how everything interplays. So yeah, fixyourthyroid.com. Definitely.
And also just to kind of recap for any people out there that have questions or want to get their thyroids run, if they go to my site, justinhealth.com or fixyourthyroid.com, you'll be able to actually order a comprehensive lab panel on there for significantly cheaper than anywhere else online. So if you want to have a good indicator of kind of where you're at thyroid-wise, that can be a great one, especially if you don't have insurance coverage or if you've kind of beaten your head against the wall so many times talking to your doctor about getting things ordered, and at the most he writes you a script for T4, then you definitely want to, this gives you an option to get a full spectrum of test runs.
Yeah, definitely. So before we go and make a 2-hour podcast, we're already 40 minutes into this thing, let's hit on some of the symptoms that people could be looking out for. Like people are going to know if I'm cold, I might have a low thyroid, or if I'm maybe checking their appetite. But what are some of the overlooked symptoms of having some thyroid dysfunction?
Well, we have our cold hands and feet. That's definitely one. Hair loss. Hair loss is the big one. We start to see hair loss on the outer third of the eyebrows. We'll start to see the hair on the top of the head to thin, because we need thyroid hormone to support, to stimulate and to support the follicle of the hair. That's super important. So if we have low thyroid, we may see hair loss. Another big one is we may see constipation. That's another big symptom. We need adequate thyroid hormone for good peristalsis and gut motility. So constipation is another big one. Weight gain. We need thyroid hormone. It's our metabolic engine. We need T3 hormone to help with overall metabolism. Right? It helps break down cholesterol into hormones. It helps break down the building blocks so we can make hormones. So that's super important. If we don't have adequate hormonal precursors and building blocks, we're going to be tired and we're going to gain some weight. So that's definitely one as well. Again, dry skin, low libido, body aches. We can see fibromyalgia as being correlated with lower amounts of thyroid hormone. So if you're super achy to the touch, some people just getting their thyroid hormone up to an adequate level, the aches start to decrease. Myxedema, or the swelling around the eyes, the little bags around the eyes, can be a sign of lower thyroid function. Again, constipation, poor memory, concentration, anxiety. Again, when you're dealing with disorders, it's like if you watch a drug commercial, at the end of the commercial, you're going to have a list of like 50 side effects. Like the auctioneer, they bring out the auctioneer to just list off all the side effects. Right? So the same thing with thyroid, meaning there's going to be a whole list of symptoms that you may have. Now, you may not have all of them. You may just have one, right? So just because 90% of the symptoms don't pertain to you doesn't mean that it's a thyroid. You don't have a thyroid problem.
Yeah, you could have none.
You may have none. We'll get assessed, and some people have decent thyroid function, and it's their adrenals that are just absolutely flawed.
Yeah.
So it's good to look at both, because your adrenals, cortisol is needed for thyroid conversion, and if you have too much thyroid or too much cortisol, that's actually going to decrease the thyroid hormone getting into the receptor site. So you have to look at everything in conjunction. You have to have that holistic, vitalistic approach of looking at everything together, not in isolation.
Also, something that you mentioned was cholesterol metabolism, that your body needs cholesterol to metabolize to make the thyroid, to make this thyroid hormone. So could having high cholesterol be an indicator of it? Maybe your body's not metabolizing the cholesterol correctly, and now you have high levels of cholesterol. Could that be an indicator of a low functioning thyroid?
Absolutely. Higher or lower levels of thyroid hormone can increase thyroid. Higher levels of cholesterol can be a sign of low thyroid hormone. Again, we need thyroid hormone. I mean, from what I understand, talking to doctors in the early 80s, thyroid hormone was actually used to treat high cholesterol levels. They were able to literally lower cholesterol levels using thyroid hormone. I've used thyroid hormone in my practice and seen a definite reduction in cholesterol levels. Now, again, we want to treat the underlying cause. Now, the next question is, well, is cholesterol levels being elevated a bad thing? Well, maybe yes, maybe no. We have to look at what type of particle size. Is there systemically elevated inflammation in the body? what's your HDL to triglyceride ratio, particle size, the whole 9 yards. Plaque markers, LP little a. There's a whole bunch of other things. So that's a whole other podcast. I don't want to get into it. I just want to touch upon the surface.
Exactly.
Yes.
Basically, why do you have high cholesterol? Is it just because you're an extremely healthy person and, hey, now you want to work out more and you just need higher cholesterol and now you're breaking things down more, so there's more byproduct of that? Or are there just a whole bunch more issues going on, exactly what you're saying? There's more tests that need to be run to make sure that it's not just, you just don't have high cholesterol, just because of a healthy response, maybe things are breaking down. And then that's a whole nother, like you mentioned, that's a whole nother podcast.
Yeah, and then, just so people know, we're not trying to, pull all this stuff out of our ears, if you will, right? There's a study here by the Journal of Biology, the Journal of Biological Chemistry, if you will, and the study was called Thyroid Hormone Regulation and Cholesterol Metabolism Are Connected. And they're connected to this sterol regulatory element binding protein called SREBP2. So just to keep it really simple, they found that a decreased LDL receptor and an increased serum cholesterol level is associated with hypothyroidism, because that enzyme, the SREBP2, will increase cholesterol levels if thyroid hormone is low. So we know there's research there, and the solution isn't just throwing people on a statin. And I'll also say the solution isn't just giving someone thyroid hormone either. We have to look at that from a holistic perspective. Maybe high cholesterol levels for that person are totally fine because their other lipid markers are great. Their particle size is great. Their inflammation is low. Maybe that's fine, but maybe the other person has high cholesterol levels because they have Hashimoto's or because they have low thyroid hormone function. So we got to look at everyone as an individual.
Yeah, definitely makes a lot of sense. Okay, so we mentioned some symptoms. People might hear this, they might go online, and they might try to treat it themselves. You mentioned the iodine, right? Somebody might say, hey, maybe I just need more iodine, whether they're getting it naturally or start to supplement. How could that be a problem?
Okay, so when you look at iodine, there's a couple different kinds of iodine. There's iodide. Iodide is primarily used by the thyroid. So when people talk about iodine, we have to look at it from two perspectives. The thyroid's primarily using iodide. Iodine is primarily used by breast tissue and prostate area. So if you're going to give iodine, I'm always a big fan of giving iodide and iodine, both. I think it's just much better. It supports all of the systems of the body, because if someone's iodine deficient, let's say a female is iodine deficient, they may also be iodine deficient in their breast tissue because the breasts take up 80% of the iodine. So they may also have fibrocystic breast. Iodine is also important for estrogen metabolism, so they may have endometriosis or fibroids or things like that. So if we know there's an iodine issue, you always want to give both forms of it, because thyroid iodine problems are a sign of iodine problems in the body. So the thyroid likes iodide, D-I-D-E at the end, and the breast tissue and the prostate like iodine. So in regards to your question, I didn't mean to get off top. These topics are so nuanced. I don't want to give people false information. But yeah, I'm always a big fan. You want to make sure you're not autoimmune if you're taking iodine. There's research showing of increased B cell infiltration into the thyroid tissue. So these B cells are antibodies produced by the immune system that can come in and create inflammation with increased iodine. So you want to be careful. You want to lower the inflammation. We have this sodium iodine symporter system, and it can get deranged, if you will, if we're given a whole bunch of iodine when there's inflammation. So you want to make sure that you're a good candidate for iodine. So at least make sure you don't have elevated antibodies. And I find people do better with iodine when they have, one, if TSH is elevated, or if T4 is elevated, because iodine's a building block for thyroid hormone. So when you look at T4 and T3, all that means is basically iodine molecules, 4 molecules of iodine attached to tyrosine. Where then when you get converted to T4 to T3, it's 3 iodine molecules attached to tyrosine, an amino acid. So you need iodine as a building block. So if you see higher levels of TSH with inadequate levels of T4, that can be a good sign that you may need iodine. Again, it gets very nuanced. It's always better to have a comprehensive lab panel to look at and work with someone that can at least look at everything and also take into your adrenals into account and make sure you're getting the right dosage, because that's a whole other problem with iodine. I personally think that people are, when they're using iodine, they're doing way too much.
Could making sure that you're getting it from food first be a better option? Like sea vegetables are really high naturally and probably have different natural cofactors. Could that be something to start off with for people to make sure that they're not overdosing on using a supplement that maybe they might not need?
You know what? A few years ago, I would be more in agreement with that. My biggest problem with it is most of those sea vegetables that I'm aware of are coming from Japan and areas where there's accelerated radiation due to the whole radioactive power plant in Fukushima going awry 2 years ago. So I'm just really concerned with the extra radiation that may be in some of these sea vegetables, because a lot of them do come from the Japan area. So I'm concerned about that.
Yeah. So source would be important.
Source would be really important. If you know the source and you can trust it and they're actually doing testing, someone would actually do the testing on it, that wouldn't be a bad idea. I think that would be a pretty good idea, as long as you know that you're not autoimmune. I think that would be a really good start. I do like giving iodine supplementally because, one, it's really, really cheap, and two, you can dose it. It's just really easy to dose. I mean, once someone's healthy, one bottle of iodine will last someone about 3 years, and it's about $20. So it's just like, it's something that everyone and anyone can be on, especially if they need it.
Yeah, definitely.
They're not autoimmune.
Yeah, it's not expensive at all. I'm lucky enough to be in Santa Cruz, so we do have like some local like fisheries and stuff like that. So I can get some good sushi, some really good healthy sea vegetables. I know that's a food that it's a lot harder to get for most people, but if you can find a good source, that's probably a good idea. And then iodine, like you mentioned, supplementally, it's not that expensive to get a liquid bottle of iodine, and just you don't need that many drops at all.
Exactly, and if you're going to do it, I'm a big fan of Iosol. Iosol is kind of like a Lugol solution. It has the iodide in it as well as iodine, because iodine primarily gets taken up by the thyroid tissue, and iodine gets taken up by the breast tissue and or prostate and or estrogen areas. Estrogen or ovary area. So really important, you want to do both. Now, the big problem with iodine is the doses. So, we originally thought, you can read Dr. Jeff Moss's series on iodine. He's a great series, kind of breaking over, looking at iodine and the history of it. But originally, Dr. Abraham came out with the research showing that the average, ingestion of iodine via seaweed in Japan was about 12 to 13 milligrams per day. So a lot of the supplement companies and people that were reading this were like, okay, let's make supplements that contain this 13 milligram per day amount. So it made sense, right? But then when they went back and they reviewed the research, the Journal of Thyroid in 2008 found, the author was Nagataki, and he found that was overestimated by about 10 times. So he's finding that the ingestion of iodine per day was around 1.2 milligrams. So kind of what I do when I start off with patients is I use that literature. I do about 1.2 milligrams per day in a patient that adequately needs it based on their lab work, and they aren't autoimmune.
Yeah, definitely. That should be definitely beneficial for most people. Like we mentioned before, it's not that expensive. It's really easy to get. What is I guess another thing that can help someone with a thyroid condition besides just iodine supplementation?
I'm a big fan of selenium. I mean, the enzyme that converts thyroid hormone T4 to T3 is selenium. It's the 5-deadenase enzyme. It's a selenium-based enzyme. And the research is pretty conclusive that if you have high levels of thyroid antibodies, 200 to 400 micrograms of selenomethionine can reduce antibodies in as quickly as 2 to 3 months. So getting a good high-quality selenium is a must. Also, the adaptogenic herb ashwagandha is great, because if you have that, if you remember earlier in the podcast, we talked about the broken thermostat, or that HPT dysfunction, the hypothalamus pituitary thyroid dysfunction. Ashwagandha can be very helpful at fixing the thermostat and also helping thyroid conversion. So I'm a big fan of ashwagandha as a herbal medicine to help with thyroid stress.
I notice that's something when I go into your office, I see you take very often is the ashwagandha and also the eleuthero. Is yours that you take extracted with glycerin or alcohol?
I'm a big fan of using herbs. Yep, go ahead.
Because I noticed you just take it like straight up like liquid form, and I noticed that I've tasted one that was an ashwagandha that was just glycerin extracted, so there was an alcohol and it actually tasted pretty good.
Yeah, it's all about compliance. Now, if taste and actually taking the herbs isn't an issue, like myself, I'll use the herbal medicines that are alcohol based because you get about a 50% increase in strength. Mm-hmm. The alcohol absorption, the absorption of alcohol takes place in the stomach, so you get a really fast pickup, and the herbs are stronger in an alcohol tincture, just having to do with the extraction process. If you talk to any good herbalist, they'll give you information on this. Yep. Dr. Nicholas Weeds is a really good herbalist that you can look him up online, but he's told me that 50% increase potency of the herb when it's in a alcohol-based solution. So I'm more of a fan of that. Again, with children, or if they have a history of alcohol abuse, we'll go with the glycerin, or if compliance is bad, we'll just go with the capsule. I mean, right now I just slammed about 1,500 milligrams of ashwagandha in the capsule form because it's just really convenient some days. Mm-hmm. But if I have the option, I slam down the herbs because really potent.
Yeah, definitely. It's funny that you say that because I think it might have been the formulator I talked to of a company called Wish Garden. They actually started working with pregnant women was their first kind of people that they worked with. So they had a really delicate population to use their supplements, and even in their supplements they have kid formulas and ones for pregnant women. They also go with the alcohol extraction. And when I was talking to her, she just said, look, it's just way more beneficial. It just, during the extraction process, it brings out the positive, the nutrients that they want just so much more, and the traces amounts of alcohol that are still remaining in the tincture, like the benefits kind of overcome the negative effects, and that's why even in their kid formula there's going to be alcohol extraction versus glycerin. So yeah, I just wanted to know if there was any specific ones that you use, and I noticed
exactly
you can actually sometimes taste the herbs. Some herbs actually taste pretty good.
Yeah, eleuthero tastes excellent. Licorice tastes really good. Ashwagandha is putrid, but the beneficial effects I think outweigh any of the immediate taste issues. I like Herb Farm is great. Gaia Herbs is great. Weeds Botanicals is great. MediHerb make really great herbal extracts. Also, Supreme Nutrition, they have really good herbs that are in capsule form. Ayush Herbs is really good. But definitely get looked at by someone to figure out exactly, what herbs are going to be best for you. Get your labs assessed and tested. You can go back and see how the herbs are actually affecting your lab work and see how you're feeling. And I know people like yourself, we offer, for right now, I'm offering still some complimentary consultations. So if you have questions and you at least want to get your labs looked at, etc., they can feel free and reach out to me, or they can also reach out to someone like yourself too. I know you're really skilled with making a lot of the dietary changes that these autoimmune patients need to be successful in healing their thyroid too.
Yeah, definitely. And like you mentioned earlier, it's not just going off of like some kind of hippie. It's like, oh, this herb, like it's not just any herb. It's also going to be studied, and I'm going to have different publications and journals to basically back up. Like you just sent me like a couple studies the other day. Like we are constantly researching in order to make sure we are up to date in that it's not just, oh, this herb is like awesome, but like, okay, well, let's make sure that the science also backs that up. Because it's really easy to get caught up into just promoting any type of natural whatever, and you get caught up in a natural fallacy of just because it's natural it's better. Not always. I mean, we even mentioned even iodine, like a supplement that could be good, could have a negative effect to somebody if they have an autoimmune condition. And if they take seaweed, that might have iodine, like, it might not be that good for that person. So, yeah.
Exactly. I think we have to do a second podcast focusing on the toxins and the infection connection with thyroid issues, and also talking about thyroid hormone itself and which ones are better. I think we should do a second podcast on that, just to give a lot of the listeners just more information regarding it without overwhelming them in one podcast here.
Yeah, definitely. So some of the solutions that you mentioned, we just went over some of the adaptogenic herbs, ashwagandha being one of the big ones. Also iodine supplementation. We want to make sure that we look at that first, make sure you don't have an autoimmune condition.
And selenium.
And selenium.
If anyone here is just kind of off, like they don't quite know if they're in that place and need anything, if you're going to do one thing at all, just get on that 200 to 400 micrograms of selenomethionine from a high quality company. That's just something you can do off the bat that's only going to help you and not hurt you.
Yeah. Selenium is definitely a good place to start, and usually pretty affordable as well.
Super cheap.
So definitely we'll go from there. If anybody has any questions, go to beyondwellnessradio.com/questions. If you need anything to add on to here, go to beyondwellnessradio.com and go ahead and leave your comments. Under this, we are also going to have it on our YouTube page. So if you guys want to ask questions or want any questions for our part 2 or part 3 of our thyroid series that we're probably going to make. This chair that I'm sitting on is squeaky. Hopefully nobody's hearing that. I'm going to stand back up. I recently injured my leg, so that's why I was sitting. I usually stand. Anyway, so if anybody wants to leave any questions, you can go to beyondwellnessradio.com and go to this link and basically ask any questions that you want us to follow up on. If you had any personal questions, and of course we always do Q&A podcasts all together, so you can go to beyondwellnessradio.com/questions to ask any other questions about maybe other hormonal issues, exercise, physiology, losing weight, gaining muscle, whatever you guys got questions for. Me and Dr. Justin could go ahead and answer that for you. So is there anything you want to leave off, or you good for today?
Well, if anyone needs to get their thyroid test done, or they think there's a problem with their thyroid and or adrenals, there probably is. Get tested, get assessed. At least do that once a year. I do it twice a year myself. If you have the information, you can always do something about it. If you don't know, you can't fix something that you're not aware of. So if you think there's a problem, there probably is. Take some action. There's always outlets of talking to natural physicians in your area, and also reaching out to us online can always be an easy, simple way of getting things done too.
Yeah, you don't know what you don't know, so get it tested. Yeah, definitely. All right. Thanks for coming on for us again, Dr. Justin. You have an awesome day.
Thanks, Barris. You too.
Got a question for Dr. J? Go to beyondwellnessradio.com/question. Then tune in to hear the answer. Also, if you like the show, review us on iTunes. For more Beyond Wellness Radio, go to beyondwellnessradio.com.